From Wana Brands, welcome to Enhance Your Life. I'm your host, Jonathan Small, and each week I talk to people from all sorts of professions and backgrounds about how cannabis has enhanced their lives and how this healing plant can enrich your life too. Hey everybody, welcome to the Enhance Your Life podcast. My name is John Small and I am your host. And as cannabis use becomes more accepted and mainstream, there is so much misinformation out there. And to help clear some of that up, we have a very special guest. Dr. Rebecca Siegel joins us. And Dr. Siegel is a clinical psychiatrist and the author of the newly published and fabulous book called The Brain on Cannabis, What You Should Know About Recreational and Medical Marijuana. And it's a comprehensive and myth-busting guide on marijuana use and its effects on the brain. And in the book, Dr. Siegel reviews the full spectrum of marijuana's benefits and risks and debunks myths surrounding cannabis and explores the promises and the risks of its many therapeutic possibilities. And the book also addresses how to effectively talk to young people about recreational marijuana, which I want to get into. So, Dr. Siegel, welcome to the podcast.
Thank you, John. Thank you for having me.
So,
it is my pleasure.
Can we disclose that you actually are talking to me on your honeymoon? That is very impressive.
Yes, you could disclose it. It is a joy to be on my honeymoon, yes.
So this must be a really important issue for you if you're taking time off your honeymoon to talk to me about it. So yes. Thank you. First of all, give us a little bit of your background. What do you do and how did you get into this line of work?
So I am a child and adolescent psychiatrist. I'm an adult psychiatrist. I've been practicing about 17 years or so, and I am the mother of 3 daughters who I used to say teenage, but they're not teenage anymore. They're 16, 21, and 24. So yes, and all girls. So
oh, wow.
I come to this from the medical and the mother perspective.
So you decide to write this book. Tell me why.
Well, so really I didn't have much to do with cannabis for many years of my life. I was a product of the 70s, this is your brain on drugs, things like that. But as a practicing psychiatrist, and one day one of my patients came in and said, wow, I have found the cure for my insomnia. And I said, what did you do? She basically pulled out a photo of a chocolate bar that she had taken, and she'd gone to Denver and had purchased a cannabis edibles chocolate bar and where it was recreationally legal in Denver. And she said, has changed my life. I do not need you to prescribe me medication for my insomnia. I said, wow, this is incredible.
Yeah.
I was a little bit skeptical because I didn't know enough. And I knew that I remembered what I knew from the 70s, but I also knew that it was medically legal in New York at that point. So when she asked me, could I do this for her? Could I help her with it? I said, I don't know. Let me find out. And just several hours later, I was ready to do this for her. I had figured out how. There was all kinds of steps I had to work through, but it was a possibility. But then it was, well, I don't know enough. And I wanted to educate myself. So I started learning. I started deep diving into it. And that was sort of the most exciting part about it. But I also realized there's so much that I don't know that, man, people can't know either, right? I don't know, and I'm a physician, and people are coming to me. So that's where I said, I got to learn more. And so I started going to different conferences. And then the book, which I have right next to me,
there it is.
The foreword was written by Daniel Amen. So I had actually recently gotten a job at Amen Clinic, which I don't know if you know what that is.
No, tell us what that is.
Amen Clinic is it's a private clinic where we do a special kind of brain imaging study, and it's called SPECT scanning. And what is so special about it is it can actually better inform people about what's going on in your brain, meaning we can better diagnoses as psychiatrists to help, not just throwing darts and medication at people. We give people options like supplements and other kinds of therapeutic options. This kind of imaging shows us what their brains look like through blood flow, through this special kind of imaging study. And it has exploded during the pandemic, and telepsychiatry has become my way of life. And so I decided that I had to write this book. And I had just started this job, and I had come directly from a medical conference for physicians in medical cannabis at UCLA. And I headed down to Amy's clinic for my very first day. And I said, I have to write a book about this. I'm going to present it to Daniel Amen, who is a very, very influential person in great health. And so when I said, I want to do this, he said, write it up. And I
Yeah.
said, what do you mean by that? So I had to learn how to write up a treatment plan for a book. And I went back to my hotel. I wrote it up. I showed it to him the next day, and he said, this is really important. And so that's where it started. He introduced me to my literary agent, and then they found a publishing company, and the rest is history. 3.5 years later, I have a book. And while I was doing it, I was seeing patients, and I come to it from a very interesting perspective. I see people who have found benefits from it, but I've also seen the opposite side. I've seen people who have been very impacted by it and not in such positive ways.
Yeah.
So that's where I walk a very fine line as a physician.
Yeah, well, and I like that about your book, that it's honest. I mean, cannabis isn't for everybody, and it also, people misuse it, even people who it can benefit. So one of the things that is so interesting about your book is that you do lay out some myths about cannabis. And I think, again, I started this show talking about the misinformation because of the sort of stigma of cannabis for so many years in this country, and that still exists, and because of things like reefer madness and the terrible propaganda against it. There's a lot of myths, both positive, negative, about cannabis. So I would love you to kind of talk us through some of those myths that you were surprised to learn when you were writing your book.
I think the main myth that we sort of addressed very initially is that either it's all harmful or it's all harmless.
Mm-hmm.
And what I've come to discover is that everyone is different. Everyone's brain is different. One person's use of it may not be another person's. And my mind has been open to all kinds of things. And when I learned about how New York State was using it, there are certain conditions that you have to follow for medical cannabis. Things like, can it be helpful for chronic pain? Absolutely, I've seen that. Can it be helpful for things like PTSD? Absolutely. But there are multiple other conditions that are directed by the states. So that's another point where if it's state regulated versus federally regulated, you have to follow what your state goes by. But people come to me saying it's helped with their sleep, which is not actually an approved condition in New York State, right? But people have told me, yes, it has absolutely helped their insomnia, or yes, it has helped their anxiety, or yes, it has helped a myriad of other things. But I've also had people who come to me and said, I did this and I felt horrible. I felt anxious. I felt paranoid. What do I do?
It isn't a one size fits all.
It's not a one size fits all. I say everyone's brain is different. Cannabis has been out there for so long. It's almost ass backwards. We have to go back and do the research to show how it might be helpful for people's brains, right?
And yet, you're right. And yet it's so widely available in some states, in some other places it isn't. But like, for example, I'm here in California, where it is widely available, both recreationally and medically. How do you know how to use cannabis? What is your advice to people who are just embarking on it or who have been longtime users and want to use it in the right way?
Well, I definitely said we want to use it in a legal way. Getting it off the street, in quotes, is not the best way to do it. You really want to be able to know what you're getting. Many states are medically legal, right? So that's the way, as a physician, how I want to help people. And I want to help people think through the mode of delivery, meaning, do you want to vape, or do you want to smoke, or do you want to use edibles? What would be the best way to get the most benefit from cannabis? And the other thing is understanding that maybe people don't always want to get high, right? They don't want the psychoactive effects. So that is also something that I have to educate people about.
Talk to me about addiction in cannabis. What did you learn, and what do you say in your book?
Well, I've learned that addiction is unique to the individual.
Mm-hmm.
I've learned that one person's addiction is not necessarily another person's. And I don't even say addiction. I say their abuse or dependence. And that's been my evolution. And that if someone finds that they are using any type of substance on a daily basis and they can't give it up, or it impacts their functioning, their job, their daily life, their associations with others, that is what you want to assess, because you don't want dependence or abuse, right? You want to do things in moderation, everything in balance, in moderation. And that absolutely, like in my heart of hearts, I'm the mother of 3 daughters. And I absolutely want to make sure that their brains are still developing, right? We want to make sure that our kids are aware and educated and understand what things are coming at them. And cannabis and all sorts of other things are coming at them on a daily basis, especially with now ubiquitous. It's everywhere. You can't walk outside in New York and not smell it.
Yeah. No, I know, that's for sure. And somebody once said, I don't think the air, well, before cannabis became legal in New York, I saw a New Yorker cartoonist say something. I don't think the air knows that it's illegal in New York, right? So,
Well, I said, I grew up in New Jersey and there were all kinds of animals that ran around. And I said, wow, why am I smelling skunk? I
yeah,
thought it was skunk.
right.
And
That's why
then
they call it
long
skunk.
ago, someone educated me right and said, no, it's not a skunk in Manhattan. It's skunk weed.
Yeah.
I said, oh, wow.
So, what are some other myths that people believe about cannabis that should be debunked, do you
Well,
think?
a very serious one is that cannabis use in youth with family histories of things like psychosis or schizophrenia may be at an increased risk of developing that type of illness or other mental illnesses. That is something I take very, very seriously.
So, is that a myth, or or is that true?
Well, we're trying to figure it out,
Yeah.
and there needs to be more research, more clinical, well-controlled trials. That is the issue behind cannabis legalization, and I believe most likely should be federally legalized so that we can do the proper research, so that physicians can get behind it and talk to their patients in a honest and understanding way for how to approach it. We're flying by the seat of our pants with this.
Yeah.
And most physicians are not even aware of the questions people will ask about it. And many people have questions.
That's why you wrote your book, because I mean, I'm in the business and I still have a lot of questions about it. Let's talk about some of the benefits of cannabis, because we've talked about some of the harmful effects here. And
For sure.
obviously, if you are prescribing it, you believe in it as medicine.
I do believe in it. Well, that's the other thing is that people need to think of it as medicine, because if it's not thought of as medicine or medication, it will always be thought about in a abuse kind of way.
In some ways, that's one of the reasons I don't like the word recreational, because it kind of connotes like misuse and like, I don't know. It's not. It's a word that actually a lot of people in the cannabis business don't use. They don't like the word recreational. It kind of like implies partying, and when actually it really is just adult use. It's just
Exactly.
yeah,
Adult use is the preferred terminology.
right. So okay, so cannabis is medicine. Medicine for what? Your patients that come to you, you mentioned sleep was one of the thing that first got you interested in
So
it.
the first person was right. There are issues with insomnia. The second person was a woman going through breast cancer, like chemotherapy treatment. And she came to me saying, I've heard that cannabis can help with chemo related nausea, things like that. And I'd heard of that actually. And so I was very interested in that as well. And so that is another condition that you can certify patients for in New York State to receive medical cannabis. And so that I saw that be very, very helpful to this and several other patients that I've helped,
Right.
through
And
the
when you
years.
work with a patient like that, do you start them off in very small doses? You try to do the balance between the CBD and the THC and the other cannabinoids. Like, how do you approach a patient?
Absolutely. Absolutely. You got to start low and go slow. And that is a recommendation that I have used across the board with all kinds of patient prescribing. You can't start at big whopping doses of anything.
That's the mantra of this show. All right. So, pain, sleep. What about anxiety, stress? This is what I suffer from. And so I sometimes wonder whether it's right for me in that way to help with those, or if it's actually going to make me more stressed and more paranoid, et cetera.
Well, I think that that's more on an individual basis. And that's where we say, you want to try it, but you want to try it in a very safe way. That's why I like medical cannabis, because you're using a doctor's recommendation. You're also going to a dispensary where people will help you. You need to, talk about what your issue is, and they are more educated and aware about it. But definitely modes of delivery are very important with things like that, right? Whether you want something that is You always want to think about the individual person. If you are coming with anxiety, I definitely think about other coexisting conditions that you might have, right? Like, what if you have asthma or you have problems with your lungs? If you feel you can't breathe, you're ingesting cannabis and it's impacting your lungs, it's going to make you more anxious,
Yeah.
right? Being short of breath will make you more anxious. But so those are things that I think about. I think about the associated conditions of whatever you might be struggling with. I also think about onset of action, right? Mode of delivery, how much the balance of CBD and THC. People don't know this.
Hmm.
And this is where I try to educate people.
Do you think that everybody should have a cannabis physician? I mean, obviously, some people just can't afford it or wouldn't even know where to look for that. But ideally, everybody should. But what about if you can't have one?
Have a cannabis
Yeah,
physician.
like specifically an MD that can make prescriptions for you,
Well, I think
or
that
an MD or a PhD. Yeah.
I think all physicians should have some awareness because people have questions and people are, it is all over and it is evolving by the day. It's out there. It's not going away. I reacted to my patients coming to me and saying, this is interesting to me. It's helped me. Right. And I don't necessarily love the way, that it was done, but I wanted to help her. And that's the first, like medicine is first do no harm, but I definitely want to help and increase awareness. Not for everybody, but can it be helpful and can it be an option? That's how I see it. I see it as an option in our armamentarium of all kinds of things, medication, therapy, cannabis, all kinds of things like that.
You mentioned you have three daughters, and I know you've worked a lot with adolescents. And I think it'd be really instructive for you to talk about how you talk to kids. We'll talk about teens when we say kids here about cannabis because, I have a 16-year-old son. He's a musician. We live in California. And even though he's a good boy, I wonder if he's going to be exposed to that. Out here in California, it's so common. Every billboard is about cannabis, and he's very much exposed to cannabis. He smells it in the air. And, if you're somebody who uses cannabis yourself, how do you tell your kids, listen, it's maybe not good for you, your brain at 16 without you mentioned the egg in the frying pan ads of the 70s that we both grew up with. It's a different message now. So what's the message that you give now?
Well, it's literally not as hit you over the head with a frying pan.
Yeah.
An egg in a frying pan. No, but it's a very important issue. And I definitely believe and know that children's brains are developing until they are at least in their mid-20s, right? And you want the best brain you can have. You want to keep your brain in the moment, but you also want your brain, you know, 50, 60, 70, 80 years out, right? And people don't think about that. They don't think about, they're living it in the moment, especially teens, right? They're all impulse and no thought.
Yeah.
They're all in the moment. And so as a parent, you definitely need to know what's going on with your kid. But you definitely want to understand that you want to keep their brains and their bodies as healthy as they possibly can be in any way, needing all kinds of substances of abuse or substance use, right? But cannabis can definitely, as we've shown at a clinic in our research and our scans that we've done, that it can impact your brain. So I can't forget that, right? So that's how I have to walk a very fine line with, how I think about cannabis, how I think about it in young people. I don't recommend it for anyone under the age of 20, in their mid-20s, while their brains are still developing. You don't want to necessarily, you want to know what's going on with your kid, first of all. But as I've shown in this research, that it can impact the areas of the frontal lobe, which are the decision-making, executive functioning, the attention and concentration. Right? You want those areas of the brain to have their best ability to develop appropriately, right? That goes with alcohol and nicotine and opiates and all kinds of substances of abuse, right? But that's what I think about.
So you told your children, and maybe you didn't back then, but you would tell them now, it's not good for your brain. Is that one thing to tell them? Because they're going to obviously be exposed
Kids
to
are
it.
curious.
Yeah.
Kids are absolutely curious. And yes, you cannot get away from it. They're having everything, thrown at them. And they're trying to make good decisions and develop executive functioning, meaning their decision-making capability and impulse control. And you want to give your brain the best chance at developing appropriately, right? But it's definitely a very, very rare thing that I will suggest that anyone under the age of 25 or so use cannabis. It's a very, very rare thing. I've seen it with severe seizure disorders in children, and that's pretty much the main reason why I might consider its use.
Right. Yes, we have seen that it helps a lot with epilepsy and seizures,
Absolutely.
and particularly CBD has also been very helpful.
Absolutely.
Talk to me about your own use. Do you use cannabis in your own life? I mean, are you able to share how you use cannabis or CBD?
Well, like the way I think about that is I definitely think about wanting to make others aware of how and educate people. That's my goal in my life and my book is to sort of educate and make aware, of the benefits, but also the less beneficial. But physicians should not be treating themselves. That's the other thing. That's a thought that I have behind that. That if I were to be interested in it, and I will say am I or am I not? Doesn't really matter, but definitely I would go and ask for help.
Right. You wouldn't treat yourself.
I would not treat myself for any condition, medication wise or cannabis wise or anything like that. I definitely would ask for help.
Well, this has been so interesting. Dr. Rebecca Siegel, her book is called The Brain on Cannabis, What You Should Know About Recreational and Medical Marijuana. Thank you so much for joining us today.
You're so welcome. Thank you for having me.
Enhance Your Life is brought to you by Wana, the #1 infused product in North America. Wana's entire process is designed to deliver the same great experience time after time. They have spent years fine-tuning their recipes so that their products are delicious, consistent, and potent. For more information, head on over to wanabrands.com. That's Wana, W-A-N-A, brands.com.